everyone. I'm Sunny from Postpartum Network. I'm a registered nurse. Today I'm at Evolve Physical Therapy with Dr. Molly. We're discussing postpartum healing and scar mobilization. So with our clients, we really stress the importance of nutrition and how good sources of protein and healthy fats can really aid in tissue repair. And then getting up and just even as simple as going for a walk can really help. But Dr. Molly is going to educate us a little bit about pelvic floor therapy and women's health and scar mobilization. So Dr. how soon after a C-section can we start moving that scar tissue?
So specifically for that scar tissue, it really kind of depends on when your pregnancy and birth, how that cesarean went. Did you have any issues with or infections with that surgery? But on a rough estimate, we're looking at 6 to 12 weeks. Say like it was a clean cut, no issues, you didn't have any infections, the tissue is healed nicely, you're no longer experiencing any like redness or swelling or any more scabs, then we can start mobilizing at like 6 weeks. But on the plus side, you can start doing like desensitization as soon as like 2 weeks, because you're not essentially touching the scar, but you can desensitize the area around it, which can really help with the healing and then the nerve regeneration as well.
Are there any tools at home that we can use to help with that sensation?
Oh, absolutely. So you can use like a light makeup brush. So make sure it's clean. So no dipping in the makeup powder beforehand. So get a clean makeup brush. You can kind of rub it along that area. You can use a Q-tip and go directly over that scar, same with the makeup brush, or like a soft cloth. And say you have a busy household with 3 kids, you can even just rub your shirt gently over that area. And I encourage people to kind of touch around that area as soon as possible, because it's something that can become so sensitive, especially with how many layers of tissue we have.
Right, and over time. How often should we be mobilizing our scars?
So I would mobilize daily. So we want to go every single day and for about 5 to 10 minutes. So say we're at that 6 to 8 week mark, we're 12 weeks out, and you're like, I'm ready to start moving it, things are feeling a little less sensitive. Or on the other end of it, you're tired of it feeling sensitive, the tissue is fully healed, we can start really kind of pressing and moving through for 5 to 10 minutes each day.
Okay. Is it ever too late to mobilize your scar?
I don't think so personally. So like aesthetically, after a year or so, like that tissue's already remodeled. It's kind of not necessarily laid the way it is, but it is.
Right.
But as far as like desensitizing it, improving your function, improving your mobility, improving blood flow to that area, no, I don't think it is.
So at what point does that shelf kind of develop?
You mean like where the scar is at?
Yeah. Is that more so related to not moving your scar enough?
Yes.
Okay.
So I would say that comes down from more so from fear of not moving that scar and not mobilizing it and taking your body through like those full ranges of motions, because that area gets sensitive. So what we might find is that instead of being able to stand up nice and tall, we might find ourselves here, and that kind of allows that tissue to bind and heal in that matter. So getting moving, mobilizing that tissue and desensitizing that tissue, because that's really the big limiter that we see, is that as that scar becomes so sensitive, people don't want to touch it.
Yeah.
And
they really don't want to move either.
Yeah.
They're afraid to do just even the littlest movements for fear of reopening it.
Yeah, absolutely. And so I would say, like, aesthetically, like if you say you do not move it around that ear mark, that shelf probably won't change.
Okay.
But yet again, we can still work on getting you stronger. We can work on improving your function, mobility, and your quality of life.
Okay. Are there different techniques that are used, say weeks 2 to 4 versus 12 plus weeks postpartum?
Absolutely. So from 2 to 4 weeks, like I said, we can kind of do that desensitization. So using those different fabrics like soft touch, using cloths around the scar, using that makeup brush or that Q-tip, maybe gently pulling up on like that higher abdominal wall away from the scar. So that can be used during that 2 to 4 weeks. And then say we come to that 12-week mark and like, I really want to start moving this. That's when we can start doing like some skin rolling, some transfriction massage on the scar, or some deep pressure and deep circles. And so that can really help with relaying the collagen tissue, helping it lay down flat instead of kind of that binded, but not essentially.
Right. Now, are there any creams, oils, or lotions that can help minimize scar appearance?
From what I've seen research-wise, I really haven't found any, to be honest. The biggest thing that you can do is like you do want to keep it hydrated, so you're using kind of like a generic cream. Can't help whether it's like glycerin. Some of the others. We have like a free up soft tissue massage that we'll use. Cream that we'll use, but essentially focusing on when we're mobilizing that scar, we don't really want to use anything, and that's what's going to really help to lay that tissue more flat and clean up that scar appearance versus a cream or an oil.
So I've seen a lot of coconut oil used in the home setting for various things. What's your recommendation on that?
I've heard that as well, and personally, like I haven't found anything to support it. But if you find it's valuable and it helps you, then that's perfectly fine. The biggest thing is we want to keep it hydrated. So staying away from like fragrance or scented things will really help to keep it hydrated and kind of improve that appearance.
Okay. And for infection reasons too, we don't want to put any sort of fragrance near the site while it's healing.
No. Yep. So you want to make sure it's fully closed.
What is your opinion on cupping, and can this be done at home to help mobilize the scar?
So cupping can be done at home. It can help with bringing blood flow to the scar, which can help with the mobility of that scar. It's kind of like doing like soft tissue massage or maybe like drying and blanking scar. It's just another route to bring blood flow to that tissue to help with the healing. But what we can do is like if your scar is completely healed, we can put cups along and kind of do that transfriction massage and go up and down along that scar or go along it in that parallel form essentially, or you can go around that tissue as well. So those are all different options that you can use.
So what tools would somebody use if they were at home wanting to try cupping something?
So there are specific cups. I personally have actually bought my cups off of
Amazon. I mean, everybody buys things off of Amazon, right?
So there are different cups. There's plastic ones that you can use, and it'll depend on like the sensitivity to the material. So like if you don't like that plastic feeling, there are ones where you can essentially like it's like a silicone one where it's like essentially will suck it up. We just want to make sure that we have some lotion across that. Like I said, we want it to be unscented. We want it to be like a cream, like a massage type cream that you would use so that we can glide that cup along. And we're not trying to suck up so much of that tissue to the point where it's painful, just enough so that we can essentially rupture those capillaries, because that's what's going to bring the blood flow.
Right.
And help to move that scar a little bit.
Okay. So next, Dr. Molly is going to show some of the scar mobilization techniques.